So we've talked about the summary panel and all the information in there. And that took us through the page 2 of your outline about home medications. And on your outline as a reminder, you want to do any word search. And it says on here that when you select a drug, you have to pick on the second or third tier that's underlined. And what that means is when you click on that initial name, it expands it, and then you have to pick something from the drop-down box. It won't even let you pick on that first tier. And then from there, we talked about the eMAR, and just like that, uncoded allergy. On page 3, we talked about pharmacy and immunizations. And then we went through the other tabs that are found on the clinical tab of the EMR summary page. Page 4, it talks about my personal notes, free text, and there's a reminder that it does not save to the medical record. And so the middle of page 4 on your outline says review visit. Review visit is the next tab in the electronic chart. And when you click review visit, it would show you demographic information similar to what we saw in the demographic tab of the summary panel. Not a lot of new information here. If you happen to work in abstracting, the footer button abstract would pertain to you. None of us do, so this tab doesn't pertain to us all that much. Next is notices. You can flip the page in your binder, and this is the help screen for patient notices. If I had a new notice on this patient, this would be red letters instead of black letters to draw my attention to it. Anytime you see red letters here, that means that you have a critical lab value. The only notice that we are going to receive would be critical lab results or critical microbiology results. Any other notices should still be verbal communication. If we have a critical lab will still call us and report off and document who they reported to, and we would still document that we received that. And there's an intervention for the work list where we would document that communication. So the only notices would ever be critical labs. Notice the send notice footer button. This is another one where we need the sweat swap, that we don't use that, because notice that the attending physician from the admissions information flows in here, and I can send Dr. Brennan a message. Dr. Brennan does not want to receive a message. They want to receive a phone call, so don't send them all these electronic messages. Call them and use the traditional methods that we've used now. Meditech can be a communication adjunct, but it's not a communication replacement. The next tab is new results. You can flip in your binder. And because I don't have any new results for this patient, and I don't believe I do for Spike either, you might look at that EMR one. Be careful where I click in there because it launches me now. It's 7:13. There we go. Thank you, Audrey. So new results is lit up, and I have some new results to view. This lights up if I have new labs or reports to view. So since lab is lit up in red and new results is lit up in red, it might be intuitive that whatever's in here is a lab. And it is. So it shows new to me, new in the last 24 hours, or if it was new within the last 48 hours. This text is red until I view it. After I view it, it's black to me, but the next person that opens the chart, if they haven't seen this yet, it would be red for them.
What if it's the next day and it's been fixed? It's not purple, but it's still red. The new person.
If it's new to you. Yep.
It doesn't show them. So if it's
Yep,
five,
it just
it's
has
like
new
that.
results that you just haven't
Oh,
seen.
okay.
As soon as you view them, just like if you're coming in and you're taking care of the patient, you're probably going to want to be reviewing labs anyway, so it's new until you review it.
But even if it's like 5 days old and it's not perfect, or it's still be red if you've been involved in that one.
If you haven't viewed it. Yep, exactly. It'll still be red. And you would still have notices if it was critical. This would be red also. So So your last 24 hours, your last 48 hours. Within this text for the coagulation and the toxicology, you can click on the result and it would show you more information about it. Maybe a reference range would be entered. Once you click off of the new results, sometimes it takes a Meditech minute, but that red light will go away. I can choose to graph these from here by right-clicking it and pushing graph, and then the graph footer button, and I can choose to see the trending here. The footer buttons show anywhere from 1 hour up to 6 years of graphing information, and I can choose to remove the INR by leaving the check in the box and only see the PT. Maybe I only want to see part of the things I selected. Hit the back button, I'm just right back to that screen. The next tab is clinical panels. If you turn the page in your binder, there's a help screen here that talks about the functions of a clinical panel. We'll go over some of these right now. I need to open up Spike again. Now it doesn't have much information charted. So clinical panels are like a summary screen for pertinent data that's been documented for this patient in their medical visit. It might be a list of their medications or the ones that they've received on the MAR, and that might also include labs. It might only include certain medications like cardiac medications. It might include certain meds like certain labs like your cardiac enzymes or your BNPs, maybe chemistry panels. It might include nursing documentation about pain and chest pain. And so we have different clinical panels available to view, depending on the situation. We might have a diabetic clinical panel. We might have a clinical panel for nursing to use to track IV sites. The people that will use clinical panels the most will be the physicians. And as you'll see, it's a nice summary of the clinical picture from everything that's been documented. On your menus for clinical panels, you might have more than what was listed on my screen, and the clinical panels are under construction, but the functionality wouldn't change. It's just the information that we collect to put in a panel. This is the ED visit summary panel for Spike. You can see I have vital signs, pain information if it was applicable and charted, the height and weight that's been documented. My physical assessment information could come in here for certain ideas like maybe edema or murmurs that we've assessed. Intake and output, certain lab tests can show. Any medications I've administered in the ER could pull into here. The active medications that might have been ordered for the patient that have been entered through the MAR, which we would not have in the ER because we don't fax our meds to the pharmacy from the ER. And then the ambulatory meds would be something that we're sending the patient home on, maybe a script for a blue pill.
Now, mine, the ambulatory meds popped up their home med list.
The home med list. And the ambulatory meds are here and queued on the discharge routine and available for e-scripts, and then it's part of the reconciliation process of whether we use that or not. If your vital sign shows in yellow, it's an abnormal result, just like if you had labs that were yellow, and it would show if it was high or low. That's based on the reference range for the patient's age, and they would consider this a little bit of a low temperature. The information that you see here through the columns at the top are sequences of time. You can adjust the time frames below in the footer button from 15 minutes up to 24-hour segments. So from 7 to 7. If you have a black bar here or a dark blue in between these time columns, it means there's no data to review here. So you notice the date from the 15th through the 18th, nothing was charted over that weekend probably. If you click in a cell that has a plus sign, what that means is there's more than one temperature charted within this 24-hour period. And if you click on the plus sign cell, you'll see all of the temperatures that were documented. And who did it with the reference range. You can also choose to graph these items by right-clicking the field and pushing graph. And then there's a footer button, graph, and the items that you selected would show here. You can see the graph from anywhere from 1 hour time frames to 6 years. If you hit the back footer button, it takes you back to that clinical panel. So it's just a nice collection of clinical information. Chest pain radiating to the right jaw. Looks like we're going to give him some cardizem. Or that we've already given him some cardizem, I should say. So now I've viewed the ED visit summary panel, and I want to view a different panel. Well, no matter where I'm clicking, where do I get out of this? There's a footer button, panels, and it takes you back to that main menu. If you have favorite panels, you can choose to show them here. If you choose standard, then you get that big list back. These are just standard content panels. We're going to tweak and adjust these. Yesterday I was like, why do I only have 3? I had to play with it for a little bit, and then I figured out, oh, if I click on standard, I get the big menu back. So if you select a few and highlight, you can choose to add it to your favorites by selecting Manage Favorites footer button, and see how I had those 3 checked off. That's what appears in my favorites. So now when I click on favorite, I just have one listed. Once you have developed your favorites list, it defaults you into favorites, but if you want to view more panels, then you click on standard. Labor and delivery panel, these all just need some updating. Some of the information that we have in our documentation right now isn't linked to flow here, but we'll be working to get that accomplished before June. In your binder, we talked about that you can right click and you can hit graph, what the plus signs mean, and on this page, it just displays all that information for you. If we choose to pull like an x-ray report or something like that into a clinical panel, you get a little clipboard icon, and when you click on it, it would open up the report for you. If you turn the page again, it shows the panels and the graph footer button. So you want to see more than one panel or a different panel, you would push on panels. And then the next page is just how to select the clinical panel to view. And then you have a screenshot of the standard clinical panels that are listed right now. Turn the page one more, and at the top of the page says Vitals Panel Topic. The next tab in the patient's electronic chart is Vital Signs. When I click Vital Signs, it looks a lot like a clinical panel, but it will only show vitals. We've put our height and weight in here just because we're so used to charting height and weight in Vital Signs in Healthland that we'll continue to do that here, and it's just a handy place to click and view it from right there in the Vitals panel. You can choose to graph by right-clicking and selecting graph. And notice that all of the things that I selected to graph in my other clinical panel are still selected here. I selected 2 items here. I have 4 things listed here for graphing. So when I hit graph, it remembered the things I was graphing in that clinical panel, and I've added a few more. But I can choose to remove certain things, and I only want to keep the temperature and the pulse rate, and so it would come in here. If I had selected to graph some lab results, that would still show here also. So just a way to scroll the information. You can scroll back by different days. You can scroll forward. That's what these buttons here do. There's a footer button called Graph Vitals. So instead of having to click one by one the things that you want to graph, you can just hit Graph Vitals, and all of these main things would come in here for you. So this is view only. You can't come in here and do charting. It's just what you can view on the information already documented. The next tab in the chart is I&O. Works very similarly to the vital signs, but you'll notice that the intake total and the output total are here at the top. And notice your time frames. It's 24 hours is the default. And it'll even calculate your balance within 24 hours. But you can change it to 12 hours with the footer button at the bottom. And so from 7 to 7, you can see what the intake totals are.
Where do you actually enter the I&O?
The I&O is entered from the work list. There's an
Oh, okay.
intake and output intervention. That's where you document them. And you're also going to see that there's a lot of work yet to be done on this panel and on the intake and output that you can document. It just hasn't been built yet. But right now, the only output you can document is urine. And so we obviously have a little more building to do. But
Can't throw up.
again, the plus sign means that there's just more charting to view here. So there were several intakes within that 12-hour period. Here there were several weights charted. We're actually going to take the weight off of here and just have it in vital signs, so it's not so confusing. Unless anyone feels, I mean, to me it makes sense to interpret the weight with the I&O, but you can always see the current weight in the header.
Do you have 24-hour there for intake and output? If you hit graph, would that show you more?
It's going to show me the items that I selected to graph from previous.
Okay.
So I could go back here and I could select. I can't pick my tallies, but I can pick the individual ones. And I can remove those other ones if I don't want them on there. Oh, and check. Check the ones you want to remove. There we go. The next tab is medications. Again, this is view only, but you get the list of the medication list for orders that are active in the hospital. You can sort this list with the drug class filter footer button at the bottom. When you click on it, you can say, I only want to see the anticoagulants, hit OK, and if they had any anticoagulants, they could show here. If you want to get back to the view for all, then you have to remove the filter with the remove filter footer button. The MAR tab here is not where we come in to document meds, it's view only. When I click on these cells, it doesn't do anything, but this is what our MAR will look like. So maybe the physician wants to know what the next dosing will be for a certain medication, then they could look here for their reference. Because on the medication list, it'll list the frequency and the start and stop time, but it would list the last administered but not the future. Medication snapshot will show the different meds listed for the different visits. If they had discharge meds, home meds on admission, the admission meds that were reconciled, and if upon discharge when we reconcile the meds, it would show here. Just kind of trending the medication changes over time. The footer button of active versus discontinued. If they had discontinued meds and you only want to see those that are DC'd, you can click that. You can choose to see all to show active and DC'd, or you can just show active. Active is what defaults in. And list gets rid of that detail screen and just lists the names of them. It's a little bit easier way to see it. View only. You can choose selected visits. There's a button at the top. You can choose to see all visits. For some patients, you might be careful that you would not want to select all visits because, boy, they have a lot of meds. It might take a long time to load that for 75 years of medical record. So, down the road, be cautious how you use these all visits buttons. The next tab is laboratory. Flip ahead in your binders, I forgot to tell you to do that. We talked about the vitals page, we talked about the I&O page, we talked about the medication panel overview. When you click this next page that says medication history viewer, if you click on the name of the medication, it brings up some history and details. Screenshot of what the medication list looks like, screenshot of what the view only MAR looks like, and then you have one called overview of the lab panels topic. The categories here only appear, these buttons, you can see selected visits or all visits. All visits just shows the most recent value for all historical visits. This second row of buttons is hematology, coagulation, chemistry. You might have more information than that. If you turn the page once more, you can see that there's tabs for blood gases, toxicology, serology, other body source. What appears here in the second column for buttons depends on what's been ordered and resulted for the patient. So every patient has a little bit different view depending on what's on their record. So if I click on the result for hemoglobin, it opens it up. I can see any comments made in the reference range. Same with hematocrit. Coagulation, I can see what the INR is. Click on it again. It'll show me reference ranges. It'll also show me any historical values there. Same with chemistry. There's a comment. You can click on this bubble and it'll open up that detail for you. Corrected report, they must have had a misentry previously reported as. And they just didn't fill out the rest of their charting. You can choose to graph. Notice that my I&O that I had selected to graph comes back in here. So I can remove that. I can right click and hit graph, and the items that are queued to graph show there. Sodium, potassium, now I'm adding chloride. Sodium, potassium, chloride, now I'm adding carbon dioxide, and I can choose to graph it. I can choose to see from 1 hour to 6 years. And you can see the trends. View only. And lab will still call us with any critical results. If this was a high or low value, it would show a different color, maybe a backdrop of yellow with an H or an L. If it's an abnormal change, you'll see a delta sign, like a little triangle in there, and it would show that you've just had an abnormal shift, even though the value might still be within normal limits. You might see an H and a delta, or an L and a delta also. And the critical ones will show in red. The next one is microbiology. It works very similarly to the lab tab, selected visits or all visits. I don't have any micro results to show you here. So in your binders, where we were on lab flow sheet, turn again and it just shows you what that lifetime last results would show, and a little bit of information of what's on your screen for your reference. And then the next page starts with overview of the micro panel. So in your binders, you can see that you have the footer buttons of specimens and organisms, and you also have footer buttons of lifetime and current. I do not have the lifetime and current listed on my screen because I don't have any results to view. So if I did, I could see the lifetime results or just the current. Specimens would show you the list of all the sputums or urines or stools that you've collected as a specimen, and then it would list for that specimen what the testing microbe results have shown. And then there would also be, as you can see in your binder, under the grid column, that little tic-tac-toe or number sign. When you click on that, it's a grid of susceptibility, so it would show you an R for resistant or an S for susceptible. And then you can also see that report column, and when you click on that report clipboard icon or the camera icon, the camera just means it's a scanned-in report that we received from maybe a reference lab quest or something. When you click on it, it brings up the report, and you could choose to print it from there.
And this will all be current, except unless we select all.
Yeah, if you select the lifetime.
Yeah.
So the lifetime's handy because you can choose lifetime and organisms, and then you'd be able to see if they ever had a history of MRSA and which type of a specimen was positive for MRSA. So the patient says history of MRSA, and sometimes it very much depends on where and what and why. And we can be vigilant to infection control policies based on the patient's record here. Also, if they do have a history of MRSA, the other place you would see that would be on that past medical history document that we fill out. And if we did have a positive for MRSA, the history of MRSA and history of VRE would show in this information box so that it's handy. It's kind of hidden back so that people that don't need to clinically know about that, it's not like in their face, but it's in there where we can find it as nurses to make clinical decisions. So specimens versus organisms. If you turn the page in your binder again, it shows you a screenshot of what the organism list would look like. And you can see that it says E. coli, and then it says Streptococcus A. And E. coli is positive in 4 different specimens for this patient. The last date that they tested positive was 12/14 of 2004. And you can see that the strep shows 1 positive specimen with that date also. So there's, when you click on those names of the organism, it opens up the detail box, and you can see also susceptibility and which specimens it was positive in. When you turn the page, this is the organism viewer, and that's what it looks like when you click on the name. As you can see, the susceptibility chart lists the name of the antibiotic, all of the S's and the R's, or the inconclusives, and it gives you a little representative reference that this letter S means sensitive. I is intermediate, not inconclusive.
Now, will we actually have these since we don't?
Sensitive one and two, so if they have
We'll have them scanned in.
organisms and the trauma bonded,
And
but
it'll look
that's-
like this, or?
Sensitive.
So you click on the
Yeah.
report, you can see it, and it'll look like
So
the
report that got
susceptibility.
from them,
Right,
not this.
it looked like a scanned report. But if we did the micro in-house, like in
And it
Sensor,
looks like this.
then it would look like that. Any questions? Those are good questions. The next page in your binder is the blood bank panel. Next tab in the chart. When I click blood bank, I get a product summary, and it would list any blood products for this patient. I can choose to see more information by clicking on it, but most of the details show on this screen already.
Get us now. You mean because of voluntary communication, I see.
Blood bank tests would show the lab values. You can see the cross-match says see detail. When I click on it, it shows the red blood cells with the unit number and the compatibility result. The transfusions button is low lit, but this would show any transfusions that this patient has received, and you can choose to see lifetime results as well for any blood products. And the reports would be something like the RIT form had to have follow-up from the Red Cross because of a possible transfusion reaction. And when we receive those reports back, they might be available here. The reports might also include something like a send-out for antibody screening for someone that's highly sensitive, that we can only do limited studies in our lab, and the rest we would send on. When we get those back, they would appear here when they're scanned. We'll cover the actual administration of blood transfusions during the ER training in 2 weeks. However, the button TAR, T-A-R, Transfusion Administration Record, and when you are in the TAR, this information is available at your fingertips without having to click over to blood bank. So that's good to know. The blood bank is view only, and it's historical data, but it's nice reference material. The next button is reports. Go ahead and turn the page in your binder. On that product summary, we talked about that for blood bank. If you click on a product, this shows you the details of the product. The next one is a screenshot that says blood bank tests with highlight. And then cross-match detail viewer, we just viewed that on the big screen. The transfusion list, it wasn't available for me to click on, but this is an image of what it would look like. When they clicked on the comment, it said the unit number and that the transfusion was normal and no issues. The last one is the reports, and it shows a blood bank history. And then we have one called reports panel topic. And so, because we do not have the build complete for resulting x-ray images and reports yet, they're still actively working on it. We'll review it in our binder. The reports panel topic can show the tabs along the top as all imaging, pathology, neuro, and it would list the different kinds of reports available to view. Those buttons will only be available if there's an actual report for this patient. So one patient's tabs might look different from the others. Things like x-ray reports would have an icon to click on to view the report, similar to pathology reports. You'd have the clipboard if it was something that was entered from our facility, and you have the camera if it was something that was a scanned image. You can click on either one and it'll pull up the report. Also, it's good to know that the dictations from the physicians for their H&Ps and progress notes will appear in this reports tab, so that's where we'll go to view that stuff.
Say that again, please.
Dictation.
I'm getting scratchy, sorry. One more here. The doctor's dictations and their H&P progress notes will appear here in the reports panel, and we would have a tab to view those.
What about PT/OT, would they be here too?
Those are actually going to be in notes and assessments, the same as our nursing notes. The only one we're still on the fence about is OT, because we're trying to find a way that Sally can dictate but still have it appear with the other therapy notes. But right now, the way dictation is working in Meditech, anything dictated goes to reports. So we're actively trying to get it into the notes because that's where everybody else's rehab notes are. As a rule, it's in patient care tab, which is the next tab. You can choose to see in reports for images, selected visits, or all visits again.
What's the difference between archived and last lifetime results? Is there a time difference that makes it an archived result?
I don't know what the difference is. It appears that the lifetime last results shows view only the most recent instances of all reports, where the archives might show every x-ray report ever available. So it'll be interesting to see with some more testing what that means, but it's not available for us to test out yet. When you turn the binder, patient charts topic has a reference page there. And this is the patient care tab of the EMR. This is where all of the nursing documentation flows to. This is like the nursing tab in the open chart. Spike has a lot of stuff documented, so he's going to just take a minute to load. Again, most of the information in here is view only. So I can choose to see assessments. Those are the interventions that have questions associated to them. The interventions would be the I did it's. I can search assessments, interventions, and outcomes, the goals, by the date that it was done in reverse chronological order, the name of the intervention itself. I can search by who recorded it, the name of the user, and I can also search by provider type if I didn't happen to know who it was. And maybe if physical therapy had a note or an assessment documented on this patient, it would flow here if it was the assessment. The plan of care tab would show a view-only image of the care plan. I'm not going to click on it because Spike takes a long time to load, but you've seen the care plan from week 1. The history tab is important to note because the history tab shows the information we documented on the past medical history assessment intervention from the work list. And what's in here is positives or all responses. The positives, as you remember, are the yeses. The all responses would be the unable to assesses or the no's, including the yeses. Excuse me. And again, as a reminder, in past medical history, it's very rare that you would ever document a no. And if you do document a no, you should really have a comment with it, because we only document the positives in that document. Except for the cardiac disorders, yes, no, unable to assess. So here we have the ear, nose, and throat disorders, no. We didn't need to go through and say, no, not nearsighted, no, not farsighted, things like that, because that could get to be quite an extensive list here for us to try and review with the patient. Viewing the positives is a much easier way to review information with the patient, but we would always go in and check all responses, because we are also checking to see if there were any unable to assess is documented that we can revisit with the patient on this visit.
How do you know if it was unable to assess?
Because it would be shown instead of a no, somebody would have picked the answer unable to assess, and it would show here. But for this patient, there's nothing charted as
So even
unable
though
to
they have
assess.
been admitted before and have a history, none of their tabs are shown out. So,
Where you guys went through and documented history for the last time. Do you remember that select visits button? Here at the top. This visit, you have no history documented yet, but if you go to select visits all, and then you go back to patient care, you should have stuff show up there. And it's, again, it takes me a little bit to load up Spike, but
Jessica, I filled mine in last week and mine has come through.
yours still came through.
It came through. And I had just filled it out just for the girls, yeah. Well, it's all there.
Okay,
Well, it's all just yeses.
okay, sure. So did anybody else's flow in automatically, or did everybody have blank on that
lots of
history?
them have it, theirs did not.
So who did not, just,
These two, Ally and Cheryl,
there's about half and half. Maybe we found a bug. So when you did the select visits to all, did it show up after that? Okay, but you had to do that first. And see, it's not supposed to. Until, I know, right? I know.
Where you at? That's on labor. Yeah.
Are you on some panel?
Chantel, you were one also? Is that right?
Would you like an out?
Yeah, I had to go back and look all.
So Chantel, Cheryl, Kendra, Ally, Karen, and Mikkel. And you guys also? You had to click all? Yeah, Lacey.
Good, thank
Oh, so
you.
you're not Kendra.
no, I'm doing all this stuff.
Sarah, did you have to click all this, or did it come in for you?
I just clicked all responses and then I'll,
The all, and it was there?
Mhm.
Okay. Just more detective work, just what I like to have. All right, let's get these bugs sorted out. So that's the history tab. And I'll just do a quick review from last week when we were documenting on the work list. We could go in and view this information that we've documented in the patient care tab. And so I could click here to view my past medical history. I would just put a check in the box and I would click to view snapshot. And it'll bring up the document for me to review. But I can't edit from here. It's view only. I could also go in and I can view my intake and output, and it would appear the same way. on the intake and output, you can see that there's a note on there. This was something that I could do in the add note routine. Do you remember when we documented things on the work list? If there were questions in that assessment, you had the footer button that you could add a note to expand on it more if you needed to. But if it's an I did it, if it's an intervention, there's no note for the add note routine. So if we documented that I did it of ambulation and we wanted to write a note to go with it, that we walked the patient 250 feet, the way it's set up right now, which we want to fix in the future because we want to be able to document that without having to do this, but that I did it of ambulation, in the example in class, you had to go to this freestanding write note routine. And those notes don't appear here in the patient care tab, they appear in the notes tab, which is the next tab of the chart. And so here I have a nursing note without a link. That means it's a freestanding write note routine. If I have a nursing note with a link here, that means it was done in the add note routine. The difference being the add note routine, you can do it right there while you're in the assessment. Otherwise, you have to save the assessment and go to the freestanding note. If I click on my nursing note to view, I just put a check in the box and hit view selected, and it shows me that I applied the ice pack to my forehead, and I did that on the 19th at 10:20. If I go into my patient care tab, I can see that I applied an ice pack in the morning also. I must have charted against the past, but these notes were supposed to have the same time on them. I can see I missed that up yesterday, 2 days ago. In the notes routine, if it has that link, here you can click on it and it will show you the intake and output assessment that's related to that note. And I can view the note that's related to it by clicking on it. Or it's Shiver's routine, that's what I typed. Pertinent. Now, in this notes tab of the EMR, this is where you can go to amend a note. So everything in the EMR so far has been pretty much view only, except for the summary tab where we entered in the meds and allergies, and the notes tab where we can go to edit notes. So if I select the note that I want to edit, whether it's a linked note or a freestanding note, I select the note, I hit the footer button, view selected. I can choose to amend the note, or I can choose to undo the note. Do you remember from our notes training, if you hit undo and save it, it's gone forever. You won't even be able to view the information that was in that note. It's not available to open. So be very careful not to click undo. But you can click amend. Undo has its place, like if you entered the note in the wrong patient's chart or something like that. Here I can add an addendum to the note. I wrote the original note here. I'm adding an addendum today at this time. Ice pack finally removed. 2 days later. Probably has frostbite. Hit OK. And now it has saved it, and it shows that I entered an addendum, so that it was edited. The tabs that appear along the top of the column for notes, I can choose to see all notes. I can choose to see nursing notes, pharmacy, respiratory. If I had physical therapy notes, I would have a tab for physical therapy, OT, speech therapy. Medical nutrition therapy is the new politically correct way to talk about a registered dietitian. So we would have an MNT note for dietitian, different things like that. You can view their notes. I can choose to amend the respiratory therapy note, but it would show who did it and when, and it doesn't change any of the original note.
I don't know all of those.
That's because your patient doesn't have anything for pharmacy or respiratory charted. So if I was on a different patient, such.
I'm writing notes on Cheryl's patient here, and she has notes in there, and then her tabs in there.
Did you refresh EMR?
When do we know that we have to refresh? Like, I don't know the pattern.
So the refresh EMR button is the next button on there, and the auto refresh is every 5 minutes for your medical record, just like the status board and the work list. Auto refresh is every 5 minutes. So if you have a lab order and you're in the ER and you're like, has it been 5 minutes yet? My button's not red. You can just keep refreshing in between that 5 minutes. You can refresh as much as you want to, every 5 seconds, and it'll bring it in.
Patient.
Sometimes so when lab
Yeah,
results are
chocolate's in the
it
room.
takes a minute to get it all over there.
So you had one in there, I'm not sure what that
Okay,
No,
nice.
this is
What are we doing, the flood sheets?
We're waiting.
Yeah, you doing okay?
I just pulled
And then
it
there was
just
There, a lot of this stuff is in red.
like previous weeks.
I put in
Right now, we're only
right now,
reviewing the current visit.
And I wrote a note real quick so I didn't want to.
So you just entered a note. If you wanna see your historical notes from the previous weeks, go to select visits and include the information from those previous visits, and then you'll be able to view the notes from the other ones. Kendra, where were you going with your question? It's not one for that. Did I answer it?
No, I just wanted, because every once in a while you'll say, did you refresh your EMR? I'm just curious as to why or when you have to do that.
That's the why level.
So every 5 minutes, it was about that.
Does anybody else have a problem viewing their notes?
Refresh EMR. And then
We don't, the reason you don't have notes in there to view is
You're
because,
not gonna work with them.
Hmm?
You don't have alert boost, there's no highlight, you know.
You can't even click on your notes button.
There's no
And the
notes.
reason, there's no notes in there for this
Yeah.
visit.
There's no.
Nothing to
duty or
view.
anything.
Yep.
So that's why.
But if you go to
I don't
this,
think, is notes part of their permanent chart?
notes is part of their permanent chart. Yep. So if you wanted to view the notes that you put in the previous week's training, go to your select visits, and then from there, choose to see the discharged ones. Select visits. Choose to see some of these other ones. And now you've got them selected, so when you go to your EMR, this patient just happens to not have any notes, but you guys should have notes available.
I think admissions must have been playing around, they're all admission notes,
Are
so.
the last button in the patient's medical record list here, from select visits down to refresh EMR, the button is called refresh EMR. What we were just talking about, but to formally introduce it, this section of the record here, from summary to notes, auto refreshes every 5 minutes. So what we document for vital signs in real-time documentation immediately flows to the vital signs panel here. And so if a physician opens the chart or another nurse, they can see the vital sign that we just documented. The record refreshes every 5 minutes when you have it open. So if you've had it open for more than 3 minutes and it hasn't refreshed yet, and you know you documented your note or your vital signs, you can hit refresh EMR and it'll refresh it before that 5 minute mark. But if I just had charted the vital signs, closed the chart and opened it again, it would appear there. But while I'm with the open chart, I have to manually refresh it unless I want to wait the 5 minutes.
So if I put a vital in, it's not automatically gonna show up for 5 minutes. So if I put it in and then Sue asked me what it was, I would have to refresh it to see it.
On your screen.
Oh.
If Sue, not even within 5 minutes, as soon as you chart it, maybe give it like a short minute to get to the server and back, and Sue opens up that chart, she can see it right away. You can see it if you refresh your EMR. And once you refresh the EMR, sometimes it's not like immediate, that 1 second. Sometimes you do have to give it like a Meditech minute to let the computer server kick it out again. But sometimes it's just that fast, and sometimes it takes a minute. So once you selected your visit, you were able to view your notes, right? Nobody was unable to view notes? Everybody could do it? Okay, good. No bugs. So that's the Notes tab and the Refresh tab. The buttons that are left on the right-hand side are unique to nursing users. And we have orders, we have clinical data that goes with part of the orders routine. Then we have the plan of care that we covered week 1, the work list that we covered last week. We're going to talk about the MAR this afternoon. We've discussed the write note routine that's freestanding. The TAR and discharge we'll talk about the last week. So every user, no matter what their desktop, whether they're a physician or admission staff, if they open the patient chart, we all have select visits through Refresh EMR the same on our screens. The only way that they wouldn't have a button is if we took that button away from their access. But these are all of the buttons of the open chart, and pretty much everybody has access to them. Just like anything else, wherever you click in here is monitored in the background by the servers. For HIPAA regulations in hospitals, you have to do that. So when you are in the open chart clicking around, it knows everything that you looked at. But it is all at our fingertips. Any questions about the electronic medical record? You guys had a lot of good questions. Sorry if we had some bugs and some hiccups, and thank you for your patience as we continue to work to build this up, and any suggestions that you have are always appreciated. So we're going to take a break, maybe like a 5 or 10 minute break, just a short one, and then we're going to jump right into orders. Just kind of a get up and stretch. We'll eat around noon, right around noonish. Some pretzels? I just typed it in. You don't like pretzels, but you just thought you'd try.
I was so hungry, I was like, well, maybe, I don't want my chips growing.
I don't even know what the salad bar to give you this morning.
Oh, that's all right. The pretzels still my
And there's no leftover cupcakes either.
Serious, entirely too healthy. I know, it probably shut down my whole system.
There's some really good cupcakes that are like something that is Oreos in the bottom. And then Oreos in the bottom and peanut butter over the top. And then they just pour the round jelly with frosting.
Oreos and then peanut butter, like big spoon of peanut butter, and then they use the brownie cake mix and just put it, and then chocolate frosting.
And you put 2 Oreos in there too.
So I got an Easter dinner, so I like to make some.
On this break, I'm going to hand out the outlines for the orders routine. And please pass around the paper puncher because I did not, these are hot off the press this morning and I didn't have time to punch them. So if you want yours punched, we'll just pass that around. The paper puncher is really good with like about 7 at a time. It can take 12, but I don't recommend it because it jams.
Did you know that the HMI has a heavy duty paper puncher?
Oh,
Yes.
I asked Jerry if anybody in the facility had a heavy duty paper puncher.
Yes, because that's what we punched the car 25 pages the other day.
We punched everything in this binder with two little janky paper punches
know.
that Jerry gave me.
No, it's over at HMI, and it's
Oh.
a heavy duty one, and you just punch it down, and Patsy and I did it, we had for our 25 pages. We did it one time.
How did you find out about that?
I think we talked to Jean.
Jean
Kim.
knew about it? Well, I'm gonna have to call Jerry. Jerry certainly doesn't know about it.
Yeah, it's an older fashioned one, but it works very good.
If you wanna know anything, see Jean.
Yeah, she's kind of in charge of that.
So the first half of this packet is the ordering, and the second half of the packet is the MAR. I'm giving the MAR outline to everybody because you might have some curiosity if you're viewing the MAR, what the icons mean. So even if you're not in the MAR training, you really do get the MAR packet. Janelle had that same sweatshirt on yesterday. Yeah, it's cute. I think it.
We found it once before.
I found that if I don't tuck my chair in, honestly, it's over it. So, if I put it over here, she's very miserable.
done, or may I
They're
decorate?
yours forever.
I'm gonna decorate.
I've been writing them.
Bedazzle the binder, whatever you
I
want.
gotta get me some of that SpongeBob duct tape.
Do they have SpongeBob deck?
Oh,
that's
yes.
That's amazing. Now, you don't have tabs, so I'm gonna give everybody some tabs for your binder. And then I'm gonna give you one extra tab that you can flag or hand out.
Yes.
Make sure your paper is lined up in the back. So make sure it's all the way in so it can go and all the way back up against the back. Yep. I'm just pushing down hard, hard.
If you stand up, it wasn't bad.
Is it right? This.
No, just,
I am so mad, we did our taxes. Well,
Put these in your other binder.
and he went up there, we brought the papers home, I signed it, we took it back up there, my two days later, you know?
Flag it.
I think the foundation. Whoops.
Some tabs for you, so you can
Thank you.
tab your sections so they don't get lost with all the other stuff. And then here's an extra one that will have you flag something during our training.
Painful.
Sorry, Molly. I'm gonna crowd you in for just a second. I can forward. Go gadget arms.
I think it's gonna be orders panel topic, I don't know.
I've never had it one time, one
You know, for me, that just doesn't go far.
Oh, there it is. It needs more flags.
I remember I worked ER for a while, only ER, and I remember when I came back to the floor, no one should rather just tell me that we were 7 days later.
oh, all right.
Let me see, what am I looking for?
Yeah.
If you're at your
I
status
had
board,
the curtain open and everything, and I'm just
It's kind of right in the middle.
Are you still recording? Come on over here in front of the camera.
have Snickers in it.
Come on over here real quick and
I have
introduce
like
this
3
section.
tabs.
Just so we can see.
If you got a
Introduce
green
yourself.
tab, yeah.
All right, we're going to do orders management here next, and she handed you out the outline for that. It was not in your folder.
This one?
All right, if you're at the status board, you'll either need to click over here to open your chart in the left, to the left of the name, or click in the open chart here. It sounds like we're having some technical difficulties here, so wait a second.
don't even know what is happening over here.
It'll say fire engine red, we're gonna assume she's the one.
My open chart goes to my summary. Set of current orders.
This one, I'm gonna say that is.
I hate to tell you, but it might be.
We're gonna actually start on page 7 of your outline, because otherwise we have to back out of the orders to do this, and it's just easier to do it
I
before.
think you've actually broken this. I hate to have to
It's the top of the page, it says number 5, clinical data, view only. On page 7 of your outline that she just handed out to you.
Maybe I should go to orders.
Maybe it is.
I'm just talking about the outline right now.
We don't have it.
There might never be
Clinical data.
Okay.
Okay.
Okay, go
Are you
look
ready?
at it and
This is not, it's busted.
I'm gonna go.
What you did, it's all right, she can flip through them
say,
and we'll fix it
okay,
again.
no, that's where you need to be, Linda, so you need to go back to this where you can. Okay, go back to where you were before.
I don't remember.
Okay, so go up.
Okay, so if you click on clinical data, which is in the
And then
right
go,
hand
okay.
body button section here, you should come to this screen with the height, weight, and code status. The only one we're gonna talk about right now is dietary. Everyone here?
Everybody there, just,
Alex? Alright.
okay, just a minute.
So at the top, you'll see current diet. Currently, we have no diets ordered. If my patient was going to surgery today, or had a procedure, you could choose to hold the tray if you had a diet ordered, and what time you're holding it and when you would release that tray. Right now, we don't have any orders, so we can't do that. This nourishment section is not to go to dietary. This is just like if I know that that patient likes warm milk every night at bedtime, I can put it in here to let Allie know if I'm not working the next night that she needs to set that up. And then this part here, the food likes, dislikes, and this section here. This section here, if you fill it out, when you admit the patient, it will flow to every diet you order on that patient while they're in the hospital. If you do not fill it out here, and you fill it out instead on the order, then every time you change that order, you'll have to fill it out and it will not flow here. This will actually stay with the chart for the next admission. These little asterisks at the side here mean that these are required information. So one place or the other, you will fill those out. Is the patient at risk for aspiration? Any food preferences based on culture or religion? If they do not, you just put not applicable or none. And then we'll go to the orders section here. So then we'll go back to the first page of your orders outline. Is everyone to this page here? If you click on orders, if you're at your status board, you will need to open your chart.
You got that clinical data warning. So just click OK. It's a warning that your clinical data isn't entered for height and weight.
You might get a blue screen that says you don't have the height, weight. You can click OK and go past that screen. It's just a reminder that you don't have those things ordered and that pharmacy for some medications will need the weight. But if you're, especially like in the emergency room, you don't have to wait and put those things in. You can go click OK and go straight to your order section. This is your current orders. Currently, we have no current orders. History is any orders that that patient has had. It can go from 7 days through 1 year, or you can choose a range, saying I want to know what orders this patient had on them in the last 2 weeks. If you click new orders, this is where the doctors come written on the chart. I'm going to place a new order. It brings you immediately, after you click on new orders, to a provider and source page. You have to choose a provider and a source. I don't care which one you choose, but you can have to. And then hit OK. Which brings up this screen here. Favorites is everyone there? Okay.
Okay.
You'll notice that the physician's name at the top of that list defaults from who the
So
admitting
then go
provider
here and
was.
click a
But
provider.
if you want to change the physician's name, you can do that. We'll talk you through that next. But for now, just highlight that physician's
Yeah,
name.
they can and tell them. Okay. Okay, now you're there.
This favorites, this will be like our most frequently ordered, most common labs. You can sort by category groups, which pulls up like your radiology, your laboratory, and others. If you click on this other tab here, that little plus sign, it drops down, and there's only 2 under other, which are admission status and code status. So if you were looking for those things, that wouldn't necessarily be too hard to find in that category. Diets has quite a few more, but it's not too wretched. If you were to click on care, which is all of your interventions, all your orderable interventions that you might have on your patient, or laboratory, you would get pages and pages of choices and options which you might not want to sit there and sift through. Just for a second, do click on the little plus sign by imaging and x-rays. And you'll notice if you scroll down to CT, the CTs all have these CT in front of them. And the MRI and MRAs will have those also. The regular x-rays, like your knee, 4 views left, does not have a CT, MRI, MRA in front of it. Again, you could do it this way. This would drive me crazy. So I would not do it that way. If you are on favorites, you're on like the most frequent, and you type in CBC and it doesn't happen to be in your favorites column, it will knock you over to name so that you don't have to sit there and sort through each one to find it. We do have it set up with some aliases, so something like sed rate, you can type in ESR and it pulls up the sed rate. You can type in SED if you look for under sed, and it pulls up the same test. You could look for it under erythrocyte if you spell it right, and it would pull that up also. So there are, for certain labs that we might not use the whole name for, we might have our own little alias that we use for it. I have put a bunch of those in here. However, you may have some that you use all the time that I've never heard of. So if that is the case, let me know. One of the labs that drives me crazy here trying to find it in the health plan system is hemoglobin A1C. I can never find it, doesn't matter how many times Char tells me, I never get it.
Is it on the red blood?
Yeah. Red blood cell? I don't think so, but I can certainly add it.
No, in health fund, I think, is that what you're saying? In
Yeah.
health fund, it's under, the A1C is like listed in the.
Oh, hemoglobin A1C, and if you type in HEM, it pulls up hematocrit, hemoglobin, hemoglobin A1C, reduced hemoglobin. If you type in A1C, it's also under there.
Is it the red blood cell?
I think
It
I
doesn't
like
matter
some-
how many.
I know, it's just bizarre.
Okay,
How about CGIF, can we have that? Yeah, cause I cannot for the life
Did you
of
type
me.
okay.
Yeah, I typed it with and without a.
I
Without space.
thought
I'll make a note for it.
I had it in there, but go ahead and write it down for me.
How about those cookie ones that Roger pulled out that the lab doesn't even know?
Yeah.
Those might not even be
Those
in
are
the system.
just trade.
Those are just made up tests.
If we can figure out what he writes and which test it goes to, I can do that. However, he pulls some up that I've never heard of before, so it's impossible for me to make an alias for it if I don't know what it is in the first place. When you type in CBC here, and I'm just going to show you this and then we'll all practice later, but if you click in that box to the left of the lab, you'll see that it says 1 queued up here. That means, okay, I know you're going to do this lab. If you have any more, you can go on. You will then either hit clear or backspace, and if you type in CMP, click in that little box to the left of the name, you'll see now you have 2 queued. If I get called away and I no longer remember what I've put in, I can go up to that queued and hit it, and it will tell me what I have ordered so far. If I then say, oh, I don't want that CMP, then I can hit remove at the bottom, and it will just leave the CBC there.
Now you have 0 Q.
She removed them all, just.
Oh, okay.
Also,
Do
you
guys
will
have stuff
notice there's a new set
CBC.
button here. That is for our order sets. And we now have a new admission set that we are doing on all admissions. In addition to like our CHF, pneumonia order sets, If I type in CHF, it pulls up the standing order set for that group. If I type in admission, it pulls up admission orders. Your patient will not have both an admission orders and a CHF set, most likely. If they're admitted with CHF, they'll have the CHF set, which includes the admission orders. If they are coming in with like diverticulitis, they'll have the general admission orders. The doctors aren't in the system yet, so they will still hand you the paper version of the order set. The good thing is when they do that, if they hand me the CHF order set, but I now have 2 queued in there, so that's gonna, it pulls up, some of these things are already selected based on what we already have selected on our order sets. The others you can click through as needed and then hit next, and that lets you put in a bunch of orders at once instead of saying, well, I need this diet and this activity and this vital signs. This doesn't mean you can't still add other orders to it. If you need them added, you can, and you don't have to go back out to do that. And I'll show you that in just a little bit.
Okay, so I see you have blood in there, so if you do the blood one, then that automatically pulls up all the blood things that you need to do to order for like a ward clerk, or is that, am I thinking the right thing? Because like I put in blood, or I don't know how I got blood. Yeah, blood administration, can you check it? Does that have all the stuff to type and cross and everything? I mean, I haven't looked further on, Audrey, because I didn't want to.
That is the orders that we have currently. So,
Okay, so there's a blood, yeah. I just didn't want to pull it up, I didn't know, but
Where do
anyway.
we see what's in the set?
That's what I mean,
you
that's what I
hit
was wondering.
next. After you select it here,
Uh-huh.
you hit next, and that pulls up the same information. Except I have my CHF on the bottom.
Sure.
As what we have now. I added some referrals and stuff that the doctors went on there.
So,
Oh, where is the individual labs listed?
but will it order the labs that are necessary for the blood
Only if
administration?
it's on our current order sheet, which I don't believe it is.
Can we
But
get it that way?
can add to it.
Yeah.
For
Wouldn't
it
that
to
be
be
nice?
added to a standing orders, I can put the labs on there, but I can't pre-select them for you.
Oh, but they'd be available, we could, so
I
that that's
could-
what we needed.
I could set it up that way. I think, without running it through the whole medical thing,
Yeah.
as long as I don't pre-select it for you. If I pre-select it, then I'm saying that that doctor says that's part of the standing order.
Wouldn't it be easier for you, Karen, if you order blood, they have it like that?
I would think so.
But I have a couple other questions for the physicians, so we can certainly cover that at the same time.
Yeah, thank you.
That's probably good too. We're doing like standing this.
Okay,
CHF.
okay.
This ER chest pain, is that like the same as the stat cardiac?
The ER chest pain order is that very short order set that just says, you know, get the EKG, do the vitals, you can have oxygen, nitro, morphine. The other chest pain one is the one that when they go to the floor. Right now, some of the labs that have to be grouped together, like the chest pain panel, trauma panel, aren't actually listed together in a panel. So right now, I put them individually on there and pre-selected them. If that, when Carol gets panels available, then I'll take those out and put the panels in.
Okay.
And I'm still waiting for stuff like, we have the CBC in, but like CBC with DIP is not there. So there are a few PKU for babies is not in yet. So they're slowly, some of those send outs especially are trickling in, but they're not all there quite yet.
Excuse me. So now we've gone to page 2 of the outline. And at the top of the page it says queued. But Audrey's already shown you how to see what's queued and what's not queued.
So just so we can see an order put in real quick before I go on to the editing stuff. I'm going to choose that amylase. It's going to queue up here, and then you hit next if that's the only order you're going to choose. That brings you to a frequency screen that gives you the stat, urgent, routine, or daily. You choose a frequency to the left of the status there, and then you'll see this little blue box. Click up here. If it's a blue box with a white edit and there's no asterisk, this button here should be highlighted so that you can just go ahead and submit the order. If there is a white asterisk here, that means there is required information and it's not going to allow you to go on until you fill out that information. You'll notice that all of this is in green, which means it hasn't been saved yet. We said it's a routine order and it's set up to draw today, right now, and this is the doctor who ordered it and the source where we received the order. If you click on that little blue box with the white asterisk, that brings you to this screen. The provider is defaulted in from where we had filled it out before and the source. You have 3 other asterisks here. The specimen sends someone from the department to collect. For blood orders, we made this the default. However, if your patient has a port or a PIC, or if you're drawing blood on a trauma patient in the ER, you might be collecting that blood, in which case you can pull down this little drop down box and say it has been collected or the nurse care provider is going to collect it, and it just allows lab to know that someone else is going to do the drawing. For things like sputum culture, UA, stool cultures, I think hemocult is still floating out there somewhere, I can't find it. Those kind of things that we normally collect, I tried to default in nurse care provider to collect, so that we already know we're the ones doing it and they're not going to send someone out to try and get a UA. Which they wouldn't, but they would frown at me anyway. Alright, reason for exam, that's something kind of Medicare insurance required as to why you're doing this on your patient. So you can free text that in and hit enter. As soon as you hit enter, that submit button will be highlighted and you can go on from there. However, you can also, from here, edit this information in the start date, time, and frequency box. If I decide I want to start this tomorrow at 6 o'clock in the morning as a routine lab, I can change it from here without having to go all the way back out. You can also change your frequency. If your frequency is routine, you do not need to order a stop date or time or count or anything like that, because it's only going to be one time. If it's an urgent, stat, or routine, you're only planning a one-time draw, so there is no stop date, time, enter. And then you can hit submit, and it will add your new order to your current orders tab. Now this is the first order I have on this patient, so it stays at the top. If I had a bunch of other orders on this patient, it would flash to the top of my current order screen, and then it would file to the correct category, wherever that category might be in my current orders list. Okay.
So if my status says uncollected, what is that?
Okay.
Did you figure it out?
We will go through that. I'm going to go through how to sort the categories and stuff, but I need a couple of orders up here, or it doesn't make much sense to sort the category. So let me put in a couple more orders, and then it'll show better the statuses and also how to sort. Because it doesn't really show much if you don't have anything in
Okay,
there.
now, why can I not submit?
When you don't have something to fill out, it must be down here or something, because you've got.
At least it's a reason.
Yeah.
Okay, now, I get it. Okay.
I'm going to go to Spike here for a second,
So
because
we're gonna draw from the IBC, just put it as.
Nurse to collector, that's
once I get Spike up here, I'll show you how to sort the categories on his, because he actually has some orders here to sort.
So if a patient comes into the ER with chest pain, then we would make that a standing order?
Alright, so these categories, this is on Spike, so he has a bunch of different categories of orders, as you can see here. You can actually sort the categories, and it will pull it up alphabetically or reverse alphabetically by care orders or other orders. Ordering provider, you can have it sort alphabetically. The only issue with this is it's only going to sort alphabetically within each category. If you hit start, I'm not sure, might be a big deal for starting your orders, but you can sort those also within the category, the renew stop, and by status. And you should have in your packet somewhere a couple of pages that look like this that has a list of the order statuses. And since Kendra was kind enough to come up with a different status list. You'll notice that there are some order statuses here and active also, just like this. If I stop an ordered lab or X-ray,
We don't have the packet out yet, just a second. Sorry, just a second.
I just wanted to. So. She's gonna tell us about these different statuses. Okay, so now
I can do it, I do show
and so she's just the stats. Oh, okay.
You guys
all
need-
right here.
you got them? Do you need them?
No, I've got them.
Okay. Alright, so there's ordered, active, and if I stop a lab or X-ray, it's going to have a stop request in red here, under the order status. That is because when we stop a lab or X-ray, they actually have a different system that they place their orders in that our system talks to. So if I send a stop, it doesn't automatically stop that order. It sends a message to Carol or Jolene to say, hey, you need to go into your system and stop that order. Of course, if they're already taking the X-ray or drawing the blood, that's going to be a little different. But that's why that says stop request instead of just stop. If it is something like a diet or a code status, those could be just a stop order because they're right in our system. There will also, you might see a complete over here. If Rod for respiratory therapy has gone, spoken to the patient, done everything he's going to do with that patient, he could complete that order and you would see it as a complete status. If you cancel an order, there is a canceled status. Uncollected, again, is going to be like your sputum cultures, UAs, things that people don't provide just because we ask them for it. So you will have it on your work list and on your orders that you have something that needs to be collected. Lab has received and results statuses for like the draft of your X-ray reports. Before they're the final copy, you might see that it says drafts or taken. Also, if there's a series order, those are usually listed in red here. And if you see this little plus sign to the left of the order name, if you click on that, you'll see that there's another, it tells you the next occurrence of it. The admission status, this is old and it wasn't working at that time, but we've since fixed it, so your admission status won't be a series order anymore. That would be more like your labs and stuff like that. There's also inactive. Pending, once and discontinued are usually pharmacy orders. You might rarely see a hold status, and that's like if the doctor says, I want to hold off on that CBC right now, but I might want it again later. There's like a hold resume that you could do. And there's also an unverified status. However, all of our users have been put in as verified users. So there should not be an unverified status showing here. Because if Ellie puts the order in and I'm working with my patient who's not doing so great, I don't want to have to come out, go through all my orders and verify them right then to get those orders for stat labs to go through. So as soon as she places that order, it's going to shoot over to lab and say, hey, we need these done stat. So if you're seeing unverified, let us know. On the frequencies, which we touched on a little bit, and we're going to touch on them a little bit more, you should have a free texting order frequency sheet so that when we get to putting in orders, you have that as a referral guide. It has kind of the standard Q,
Flag that page with one of your post-its.
Q,
It'll be
space
easier to
H.
find.
And those are kind of standard ones that we can use, and when we're practicing our orders here in a few minutes, it'll be nice to have that handy. Because Spike here has a lot of orders, I'm going to go through the edit multiple routine from his chart instead of from the one that had just like 2 orders, because it's a lot more fun if you have more things to click. So on the bottom of the current order screen, you should see an edit multiple tab. Everyone see that? If you click on that, this should be, the edit multiple screen should be the next screen you see. If you click on a couple of those orders, that should make these footer buttons, all except for the collect specimen, it should make these footer buttons all highlight buttons. You can start an order, which
We don't have much orders.
My kids have been button I can.
okay, that's probably because you probably have order in there. I don't have a current order on Spike that I have that I can collect, so it's a little bit. If I want to stop the orders from here, I can click stop and do a bunch of orders instead of just one at a time and say, right now, I want to stop these orders. It will require me to put in a reason. And then those should be, you should see all of these have been stopped. So you'll have stopped, you'll have stopped series. If they were lab, stop request. So you select your orders, and then you hit submit, and it should show that for you. And we'll go back into that edit multiple again here, and click on a couple more. You can renew an order, which I don't think we'll be doing much renewing from here. Most of our renewal is more like on NARC orders and stuff, which will follow the same process where we refax the new order to the pharmacy and they renew that med from there. Review is, and we'll go through this in just a second. The review, which will also cover more in manage orders routine, is like your 12-hour chart check. Collect specimen, which for me is low lit now. I'll show you on another patient here in a second. Acknowledge is like our noting process right now, where we go, we have the chart, word clerk maybe has put the orders in, and we're sitting there and we're checking them off one by one, and we say, yes, these are correct. You can hit acknowledge. Right now I don't have any orders to acknowledge, but if I did, I could then hit acknowledge and okay, and it would acknowledge my orders, which would be like our noting routine. Complete, if I'm completing out like a respiratory consult, you can hit complete if he's completely done, and then submit. You'll see that it changed that to a completed status. Here's this canceled. Okay, on Miss Maggie here. I have a UA on my patient Maggie which is uncollected. If I go to edit multiple, I can select that UA, and if I have a sputum culture stool sample, whatever, I can also click those because of course Maggie would have given me all the specimens at the same time. The collect specimen button then becomes highlit because I have that to collect. If you click on that, it pulls up this and you say when your collection date and time was, and it switches it to has been collected. You hit OK, submit, and you'll see it flash for just a second to collected, and then it went to ordered. If you then go to your work list, it should have taken your UA and completed it off of your work list.
So it's just gone, or
It should be gone.
Because otherwise you-
Now, if I click from the UA would have shown up here, so as the CNA, I could have clicked on the work list and said, I have that collected, I did it, and that will also send to your order and say, hey, that's been done. So when we get the UA order, we don't do it like we do now where we wait until we collect it to order it and put the task in. We put that order in, it speaks to the work list and says, you have to go collect this. And then as soon as you click on that, it says, we have it, it's been ordered.
So in the ER, so if I get the UA, when I order it, do I need to go, after I collected it, I don't need to go back into the work list and mark it wrong? Okay. So then do I want to, like now we're in the I&O where we make a note, like if they void, and then we put UA to lab, do we still need to do that?
You would still want to put the output in there.
Right, but I don't need to make a note that, okay.
because we've already said that.
Yeah, you already said. And if you're at the work list, you don't have to then go into the order. It speaks to one side to the other, so you don't have to be doing that.
Audrey, now I had put in an order for Rod to come see, and so I put a respiratory consult in, and then I edited and put in that it's complete, and then I took it off. So it just drops completely off, but where are you gonna find it? You can go to, okay, so I was wondering,
If we hit on back,
okay,
and you go to history,
history, okay, that's what I was
all your
wondering.
orders should show up
Okay,
there.
because I thought that it would stay up there, but otherwise it went right, it fell off.
When it's discontinued, the MAR is a little bit different, but on the orders, if they're discontinued or canceled or something, a lot of times they'll go to that history section. So if you want to see everything that's been ordered, you go to the history.
Okay. Thank you.
We do not have. Let's go back to orders and edit multiple here. We do not have the verified, that undo button. If I click on a bunch of these orders, and since I only have 2, that's not going to be a whole lot, and I hit undo, that will take all my check marks out. However, if I clicked all these to say I'm going to cancel them or stop them, and I hit submit, undo isn't going to save me. I then have to go back in and reorder everything. So kind of know where you're clicking. If I went everything, and on Spike I had like 100-some orders, I could click this universal and it would apply them all. Now, if you're noting the order or doing 12-hour chart check, you're not going to want to do that. You're going to want to go through and check each one, you know, not just universally click it because you could be saying something you don't want to say. And if I go to history and I click on this, you'll see that history audit trail, and we'll show you this again in manage orders when we do our acknowledging and reviewing. It keeps track of who entered the order, who edited the order, who reviewed it, who noted it, all that good stuff. All right, everyone with me so far? Yes, Alex.
Okay, so if I order a CBC,
I
it goes
just
through
clicked
the
it
lab,
again.
and then
Clicked
the
it
doctor
again?
says, you know what, let's get that again in 12 hours or 10 minutes, or do I have to reorder it, or can I edit the original order to say?
In that case, if you had a one-time order, I would probably go in and enter a new order, because it's already communicated, if it's not like right when you're entering the order, it's already communicated that order to lab. So, everyone ready to try some of you have been clicking along, so I know you're already trying it. On a CBC, we can go to new orders and select a physician. If the physician you want is not listed here, you can hit other provider, and that will bring up a list of other providers. This is not, it was complete until we got a couple new PAs, so we have to add a few more names to this list. And then you can choose your source, whether you're getting it from a written order, a verbal order, telephone order, or standing order, and then you select OK in the right lower hand corner here. Everyone with me so far?
I'm lost.
It is what you wanted.
I was.
You're gonna go back to order.
And you'll just say OK there, because that's a soft.
The weight, now you there.
Now you hit new orders,
There you go.
and then choose your physician and source.
Oh, is that what I'm doing?
Okay, so.
Well, you gotta pick one out.
And you can choose a CBC or just
Go back and go back to your,
I think
go to Kramer, you can get somebody else. There's
All right, so I'm going to do,
I'll just
a
go back and
CBC.
see there. And just pick one.
and I'm going to click in the left, to the left of the name of the order here, you'll see one is queued. I'm just going to do this one order right now. And then I'm going to hit next. That'll bring up my frequency. And you'll notice you have that blue box with the asterisk, which means we have required information. My reason for the exam is going to be fever, and make sure you hit enter, because that's what's going to bring your submit button to a highlight status so you can move on with your order. You can change your frequency, your start date and time from this area here. So if I say, oh, all of a sudden my patient's doing much worse, you can hit that drop down and pull in like a stat order. And hit submit.
How you doing?
next.
You'll see that it came up to your current orders tab. Everyone get one order placed. Through the submit, it's on your current orders tab.
The reason why. Not doing that. And submit.
Alright?
Good
Perfect.
job.
Alright, next we're going to do a diet order. Now remember, if we did not fill in those two mandatory questions on the clinical data section, it's not going to flow to all of our orders. So we might, if we haven't filled that in, we will have to fill it in here. But we're going to new orders and select a physician and source. And type in, you can type in regular, you can type in diet, just to see kind of the different options it pulls up for you. And select that to the left of the order, there's a little box there, go ahead and select that, and you'll see one is queued. If you hit next, you'll notice this screen here. Our diets are set up a little differently in Meditech than they were in Health Ed. Here it says, this is when we serve our meals. Breakfast starts at 7:20, lunch at noon. Noon, it will tell you when which one is the next meal. So if I'm admitted at 2, it's going to say your next meal is supper. But you all know me, I'm not going to wait. If I'm admitted at 10 o'clock in the morning, I'm not waiting till noon to eat. So you can actually, right now it'd be kind of silly, but you can actually say, I want to start with breakfast, and it'll pop up a screen like this that says start time is in the past. Do you want to continue? Either you say yes, I do want to continue, which if it's like 10 o'clock in the morning or if it's right after they've sent out breakfast trays, I would probably then, this will communicate to dietary, but because they're going to be busy cleaning up and setting up, go ahead and give them a call and let them know. But this will send them a notification that that patient wants that tray now. You can say start tomorrow, which I'm gonna be awful hungry and cranky by tomorrow. Or you can say, no, I don't wanna start this, I wanna wait and start with lunch since it's in 5 minutes, I suppose I can wait. There is a blue edit here, but mine does not have the asterisk, so mine's filled out, so I can go ahead and submit. Once you have your diet order in, let me know and we'll go on and we'll do a couple more complicated ones.
That's that. They'd have to take away my salt shaker.
You can have my pretzels, they have salt on them. That's all they have.
I don't like the salt.
All right, so if we're ready, we'll hit new orders again. Again, select your doctor and source. We're doing this kind of the long drawn out way just to get in the habit of doing it. You're not going to do this with the orders you receive, you'll put them in all at the same time. So you'll be choosing your order and physician and source one time instead of like a zillion like we're doing right now. So, Allie needs a Foley. So type in Foley,
Oh, fun, Allison.
and click on Insert Urinary Catheter. And then hit Clear or Backspace and type in IV.
Oh,
And select IV Initiation. You'll notice you now have 2 orders queued here. Go ahead and clear that out.
clear one out.
Well, you don't have to clear it out.
Oh.
You can if you want. It bothers me, so I clear it out.
Okay.
And then you hit Next. And that brings you again to your frequency screen. You
Did you get
click on your frequency and it
Put your
pops up
insert
your
folder.
edit
Did you do that one?
button.
Okay, now put your, okay, there, see there?
Alright, once you get to that bar, stop.
You got your orders. See, yours are a little different than mine, but
Did you get,
I didn't get that.
she's got it, but hers looks different than mine, so I don't know which one's right or which one's wrong. I don't know. I have the insert Foley one for stat or that, and she has that. So I don't know what we did different.
you don't have that.
No.
Oh, were you in queued orders maybe? Go ahead and hit new orders. Because that looked like the queued order screen. And go ahead and type in Foley.
And then you gotta check it.
And then hit clear, because that one's saved. And then you can type in IV. And click on IV initiation. In the box to the left there.
You was not checking.
And then you can either hit next or there. Now you should have the same screen. And then you choose your frequency there. So you have to click in that little box to the left of the frequency and that will pull up your blue tabs that say, I have 2 things I need to edit information on. You could do them individually, but that's going to get awful annoying in a hurry. There's this edit all button at the bottom in your footers. If you click on that and don't hit next when you fill out your asterisk information, but just enter through, it should take you to the next order.
Really?
So the only information on your urinary catheter screen that is asterisked and is required before you move on, it says urinary cath orders. If you pull that down, this is where you say, I'm going to put in a Foley to dependent drainage, I'm going to straight cath because the patient's distended, or I'm going to clamp the Foley and
Sorry,
circle
you
and
said-
bladder drain.
You wanted us to pick which one? Foley to dependent.
Yeah, you can pick whatever you want.
Straight.
You'll notice there are some information tidbits written on here. Do not insert if there's blood present at the urinary meatus, and indwelling catheter should be secured to the patient's legs. That's just information for you. There are also boxes here that are not required, but if you have urinary catheter clamping instructions that are specific to your physician and are not the protocol that we usually use for like the suprapubic catheter training patients, those you will write in here. You also see a specified catheter size to be inserted. Some of our surgeons require a certain French of catheter to be inserted. That's why this is here. It is not required. You do not need to fill it out. You can enter through from here. And Kevin assured me if I did this,
figure this out yesterday. So if you didn't want to change anything else on here and you scroll back up to the top of your screen, if you highlight IV next, then it brings it up where you don't have to enter.
Oh, really?
All right. Then in IV,
That's
the
it.
only asterisk one you have,
I didn't get next. I mean, I didn't have
you can go to the top of your screen
Okay, I
and
didn't have
choose
IV.
IV.
IV. But I had IV done. I had that both down there, so I'm gonna go next.
If you've already
We just
finished,
didn't have the
yes,
check in the
but I'm
Oh,
gonna
yeah,
talk a little
so
bit
it
about
didn't
what's on the
run.
IV
Okay.
screen. There's IV saline lock orders, that's the only one that's asterisk, so you can choose saline lock, IV, bolus, or C other. If you put in C other, if you have like, I'm gonna finish this bolus from the ER and then I'm going to continue with my ordered IV fluids, you can free text that in here. You can put in your IV rate, you do not have to, that's going to show up on your MAR. 2 IV sites needed for some of our trauma patients, chest pain patients, stroke patients. You may need 2 IVs, so that's why this is an option. You do not need to fill it out. It is not asterisk. It's only if it's specifically ordered by the physician that you would fill it out.
Cool.
Same for specified site for IV placement. Stroke patients, if the doctor wants to start on the non-affected arm, or you know, or if the certain surgeon wants them in the left arm, that's where you would put that. If there's a specified gauge for IV placement, your trauma patients will have the 16-18 gauge. And then you submit, and it takes you right to this screen.
Cool.
Then if you, when you're done with that, if you click on work list, the right body button here towards the bottom, you should see that you have an IV initiation, insert urinary catheter on your work list. There's AO and IO. The O means it's an ordered intervention. The I is just like an I did it. That's something that, okay, yes, I did the I and O. It puts a little check mark in there. If it's something like your insert urinary catheter or IV initiation, it's going to have an A. That means that there's going to be some documentation there, and when you click, it's going to pull up a documentation screen. And you'll also see both of these have P's on them. That means there's a protocol associated with them. If you click on the P, it pulls up the protocol. The O means it's ordered. I brings up if you have intervention text here, which you can then edit and change for your patient. It is not applicable. So if I click in that box for insert urinary catheter and document, it's going to look differently than if I click in the I and O. It's going to bring up the actual documentation section. And if you go back to orders, we'll do a few more here. Are we getting close?
So I click now, but I'm ready now to do some.
Now and document.
Okay. Okay. Nope. I just lunch. All right. Jess has to go across the way to get the lunch. She's gonna bring salads back here and we'll eat them here. If we'll clock out about 12:15 for 30 minutes. If salads are okay, they're very kindly providing us with chef salads, which you can dump as much dressing on as you want to make it completely unhealthy, like me. And they've been bringing cupcakes also. Ellie, I knew that would be especially interesting too. But if you choose not to eat here, you can go ahead and leave, but then it's on. I'm all for free food. Yeah. So if you go to new order again and select the physician and the source and hit OK, type in TEDS, and it pulls up a circulation immobilization device. Go ahead and click in the box and then hold there for just a second for me. Okay, you can go ahead and save and go back to your orders screen so we're all on the same one, okay? Do new orders. Choose your physician and source. Yep. This one, because otherwise you're gonna have different screens. Okay. Okay. Everyone okay?
I'm charting on my IVs. I'm screwing up.
You
I'm
can go
sorry.
ahead and save.
I tried to save, but it said I have some IVs on missing field, so I'm trying to figure out where they're at.
There should be asterisks if they require your insertion date. Just type in T and enter and you should be able to go on.
He has nothing below his pelvis. I don't even know if he has a pelvis.
And next week, they're going to have, pretend patients for you to practice on, so you'll get to go through the whole thing, so
We got.
it'll make
when are
a
we
little,
supposed to order
it'll be a
now?
little more stressful. But it'll also kind of hopefully pull everything together.
And then we'll have 2 months.
So you type in
Start
10,
again. Forget it, I'll
You
forget it.
click in the left-hand little box there, you'll see it's queued up one, hit backspace or clear, and then type in code.
You said
We're gonna
PART-2.
do 3.
Yes.
Click in your little box there, hit clear, and type in oxygen. And click on oxygen delivery orders. You should have 3 queued. Hold there if you get that far.
You should have 3 queued.
What was the other?
What was the other? one?
Oxygen, code status, and 10.
Oh, close text.
It's not queued.
Just put code, don't put so many words in that one. COD.
Yeah, that's, yeah.
That you have to queued.
Okay, that, yeah.
Now, if she wants to sit tight, right, for a while.
Oh, for code, now hit
Do you
clear.
have 3?
Hit clear and now.
I got him up.
Okay. Okay, everyone has 3? Okay, so now we're going to hit next. And it brings up your frequency here. So go ahead and click Q shift, routine for code status, and nasal cannula for oxygen delivery. On oxygen delivery, there's a couple things I want to point out. On your non-rebreathing mask, it says 12%. That drives me crazy, because it's supposed to be 12 liters. That's hard-coded into Meditech, and they're supposed to be fixing it within the next 6 months. But we're gonna have to deal with percent there. It's not percent. Also, they do not have a high-flow nasal cannula option, but we can edit that on the next screen, but for right now, it's not there. They're supposed to be trying to add that. If I choose nasal cannula, this says 4 liters. But I can edit that on the next screen so that it will say the 6 liters that my patient is really on. So choose the option that is,
Or you could just go to the number and change
you could, but we're gonna change it next because it's easier because you're gonna change everything anyway. Yes, if you have that order on your patient, you can actually, and it's already entered, already completed and everything, and your patient, you titrate them up to 6 or down to 2, you can actually click on the order and change the flow rate from there. But for right now, while we're entering, we're gonna hit that edit all, and it's gonna bring up the top one, which is your circulation and mobilization devices. That is right here. You pull that down and it's a yes or no. You just type in yes, and then you can say, my patient has TEDs. I call them SCDs. People here call them pneumatics. This is where they would go.
Yeah. Sometime
So
around
yes,
this
my
time.
patient has TEDs.
I got
You
you.
get yes, you type in comment TED.
Okay, so go to maybe the oxygen, is that what I want to go to?
No, you want to be on circulation. Right?
Circulation, okay, I was there, and then what?
You pull down your circulation there.
Oh,
And then you just click on yes, and then type in free text TEDs, and then hit OK.
So this is where we will put in the managed.
this is where.
Now hit click that color, that color. And now you're on TEDs. Go ahead and pull that down. And so you click on yes, and then free text.
So if they were on the managed,
You can type in yes. You can type in Now, there's only one on here that is required, and I'll show you that in a second. The other required is the site of device application. So if I just have TEDs, I can put bilateral legs here. And that is fine, and you could go on from here. However, if I also have a C-collar on that patient, and I choose a mobilization device and choose hard C-collar, then it's going to look like my C-collar is on my bilateral legs. So you can actually, if you have the immobilization device and the TEDs or SCDs, you can actually click in that and see that little X at the bottom of your column. That will take out your selection of bilateral legs. It will not let you backspace or delete it. You have to hit the X.
Why are they asking about a C-collar under circulation?
Well, because it's circulation and mobilization devices. And then you can always put your application devices up here. For your TEDs, so that it's all together. And then you go up to the top and click on code status. And there's only one question on there. That should look good after the other ones. And it's required. So right now, this facility says we're only going to use full code or DNR. I know occasionally I see a compressions only, but according to the facility, they need to be either a full code or a DNR. So that needs to be addressed with the physician and the patient if you are seeing compression only. I'm a DNR, so that's what I'm going to choose. And then I'm going to
Not if I'm around.
then I'm going to click on oxygen delivery orders. The first box is your flow rate. You can increase that to a 6. You can either type in 6 or pull up the calculator with that down arrow and put in 6. There is the option to put oxygen continuously at 4 liters nasal cannula until MIA ruled out. That's there in case your patient would develop chest pain when he finds out I'm his nurse. But you don't have to fill that out unless it's applicable. There's an asterisk by oxygen delivered by. That means it is required.
You can put the high flow though there. Right?
Yes, you can choose your high flow here. And you can use either simple, you might do simple mass with high flow because maybe your oxygen level is going to be a lot higher.
We have that under nasal cannula.
I'm only at 6 liters.
But our heading or whatever the top order is nasal cannula.
Yeah. But we don't have that hard-coded option of a high flow.
But you were talking about simple mass.
Yeah, you can put
That's
it
our original
under,
order.
you can put it under a simple mask and then put it in there so that on the detail of the order it says high flow. Because it's gonna look silly if you have nasal cannula on there and then it says like 10 liters. You're gonna be like, what?
Well, I have 666 liters.
So you can choose nasal cannula. If you have an oxygen titration order, you can address that here by pulling down that apply oxygen. And it pulls up the 3, I would say the 2 most common, which is to keep SATs greater than 90 or 92%. Once in a while, we will have patients who are like in-stage COPD and the doctor says, no, keep them at like 86 to 88%. In that case, you would hit that other C comment, and then you could free text it into the oxygen related instructions.
I want to get rid of this.
And then you should be done and able to submit.
But it doesn't say anything about this, the oxygen in there's one keep 60s, and then it'll say in the order.
Or does it say in the summary?
It should say on the,
So how would you know that unless you look at
Well.
the order?
That.
I don't have it. And you just have samples, so that's good, something
want to have filled out? Something anyway.
There's on your oxygen nasopharyngeal delivery, it says order, and you would click on that, and it will bring up all your orders.
Oh, okay.
So did they say
Yes.
anything about, or did you have that in there?
I free texted here. There's
Okay, okay. I'm seeing.
And it says in there, like weaning, if you're titrating your patient or weaning your patient, or say your patient only wears oxygen at night, that would be, you know, something you would put in those oxygen related instructions, because that's something that changes your patient isn't always on 6 liters. At night they're on, you know, 2, or maybe they're on 2 all the time unless they're ambulating, and then you need to increase it to 4. That would be kind of where you write that. And then we're going to take a break before we start series orders and eat. So go ahead and clock out for your 30 minutes and save all your questions to hit me with right after lunch.
Somebody set a timer because I only checked out for 27 minutes last time. And I only get 2 more warnings.
Is that what you were
I don't
told?
know.
happens if we get
It just said that we're only gonna be allowed 3 warnings before there would be a crash.
Oh, then you get a letter.
I think that
Being
means
late
that
3 minutes?
Education
Or
things.
early?
It's like the gold star of your life, you're gonna take off work, I think.
You know, Amber's did that, and she's still around.
Oh, yeah.
She's getting 3 warnings. Yeah, I must have worked late.